Good morning. I'm Dusky Terry, President of ITC Midwest. For the third straight year, we are pleased to be the presenting sponsor for the Iowa Ideas Conference and extraordinarily proud of our partnership with the Gazette. As an electric transmission company serving 2/3 of the state, ITC Midwest is invested in and has a very real stake in the future of Iowa. We've supported this conference since its inception because we embrace its mission of gathering hundreds of Iowans together to explore the key questions and the big ideas that will shape the future of our state. ITC Midwest was formed in 2007 to improve electric transmission reliability and increase transmission system capacity in Iowa. And we followed through on that commitment with more than $4.1 billion in capital investments to date. Our investments in the system not only serve the changing needs of customers, they also provide additional capacities to support economic growth and development of low-cost renewable energy resources. Our investments have resulted in a 62% drop in transmission-related outages since ITC acquired the system and began operating it. From extreme weather events such as last year's derecho to the unprecedented transition to renewable energy, from the rapid adoption of electric vehicles to the increasing focus on energy system resilience, the electric utility industry is suddenly in the national spotlight. All of these forces reinforce the critical role of the transmission grid to support the changing landscape and ensure consumers have access to low-cost, clean, and reliable electricity. You know, we often talk about here at ITC about the power of connection, meaning connections are needed to deliver power to communities. There's also tremendous power when people connect to solve problems. Over the next couple of days, I hope you will engage in the breakout sessions, speak up during discussions, and share your ideas to create a brighter future. Open your mind to different points of view as we all work together to come up with the best solutions for making Iowa an even better place now and in the future. I want to thank you for your participation to help shape the future and wish you a great conference.
Good morning, everyone, and welcome to our panel called Violence in the Home. This morning, we'll be exploring trends in domestic violence in the home in light of the pandemic, as well as how our agencies in Iowa have addressed the increase and what their thoughts are moving forward. We're fortunate to have three very experienced folks in the field joining us today. First up, we have Dr. Maria Corona with the Iowa Coalition Against Domestic Violence. Dr. Corona, why don't you tell us a little bit about yourself and your organization?
Sure. My name is Dr. Maria Corona. I am the Executive Director at the Iowa Coalition Against Domestic Violence. We provide training and certification to those doing the direct service work with domestic violence survivors. We also provide technical assistance and support to our network of 22 member programs across the state of Iowa, of which Kristie and Nelly are part of. We have some direct service work that includes our legal clinic that provides family law and immigration law consultation and representation for survivors that need and qualify for those legal remedies. We have a housing and economic justice program that includes financial empowerment classes for survivors across Iowa, as well as our Alice Barton Educational Scholarship to anyone that resides in Iowa and that identifies as a survivor of any form of violence. And we have our Skylark project that offers commutation assistance and comprehensive services to victims of domestic violence that are incarcerated at the Iowa Correctional Institution for Women. Of course, we also get crisis calls, and so we do some counseling and mainly referrals throughout Iowa to our member programs. And we do have a client assistance fund to provide immediate emergency needs to survivors that we work with or that our member programs work with. And I've been in the anti-violence movement since 2013. I worked as a direct service advocate at one of our mainstream programs, Access, in Ames, Iowa. I primarily work with survivors in Marshall and Tama County, survivors of domestic violence from historically excluded communities that had limited or no English proficiency and had unstable or no immigration status in the country, and that also had specific cultural needs. I also have conducted research on intimate partner violence throughout my graduate student career and received a PhD in Human Development and Family Studies last year out of Iowa State University.
Great, thank you so much. Next up, we have Nelly Hill, the Program Director for Waypoint's Domestic Violence Victim Services Program. Nelly, tell us a little bit about your experience at Waypoint and the folks you serve there.
Sure. Waypoint's domestic violence program serves 7 counties in Northeast Iowa. We're the comprehensive program, which means we provide safe, free, confidential services to survivors. We do legal advocacy, medical advocacy, support groups, peer counseling, financial assistance, really fine-tuning the services for each individual's experience. I've been with Waypoint for a little over 13 years, specifically working with domestic violence and sexual assault victims.
Great. And last but not least, we have Kristie Fortmann-Doser, the Executive Director for the Domestic Violence Intervention Program. Kristie, I know you've been in this field for 35 years, so tell us about your experience in the domestic violence field and what your organization does.
Good morning, everybody. My name is Kristie. And yes, I'm the elder of the group. There is no question. When I go out and speak, a lot of times I'll ask people who were born after 1986, and an alarmingly larger number of people keep raising their hands every darn time. Yes. So anyway, I've had the tremendous experience of seeing how things have changed and how we've developed and how we've evolved over the last 35 years. The Domestic Violence Intervention Program is very similar to Nelly, so I'm not going to repeat a lot there. We provide crisis services and comprehensive support for victims of domestic violence, dating violence, stalking, human trafficking. And probably the biggest difference between the two programs is that we have emergency shelter services and emergency advocacy services where we accompany law enforcement. We have been doing that for 42 years here in Johnson County, and we serve a total of 8 counties, and we pretty much start at Interstate 80 and head south to the border of Iowa. I think that I've had the opportunity and wonder of getting to try a little bit of everything here at our organization and in organizations across the area. The big joke is that I've done everything but child advocacy. And it's because kids figure out really quickly that I'm very theatrical and very, very fun for about 10 minutes. And then they're like, where's your candy jar? So I've gotten a chance to work shelter, to work our crisis line, to work our court system and medical advocacy, and work in our communities, and be a liaison on the state level with the Iowa Supreme Court and the Department of Justice, and a whole series of organizations. Way too many to list.
Yeah, we're so fortunate to have your breadth of experience here, so we appreciate that. And I guess I should introduce myself. I didn't say my name. I'm Elijah Decious, and I'm a features reporter here at the Gazette, and I'll be your moderator today. The first question I'd like to pose to each of you, and we'll start with Dr. Corona. Dr. Corona, help us understand the trajectory of domestic violence up to the pandemic and through the pandemic to the current state that we're in right now. How has the pandemic affected domestic violence and the folks that you serve at your organization?
Yeah, sure. So I think first and foremost, we have to understand that domestic violence is a public health crisis. It impacts 1 in 3 women and 1 in 7 men during their lifetime. This is a global epidemic that can happen to people regardless of age, race, gender, ability, socioeconomic status. And domestic violence is actually called the shadow pandemic because gender-based violence thrives in secrecy behind closed doors, but it happens across neighborhoods, communities, societies, and that's why it takes all of us to raise awareness about domestic violence and to create change. I would say that in 2020, during the pandemic, ICADVA's network of 22 member programs served more than 30,000 survivors across the state of Iowa. And that's data from the Crime Victims Assistance Division out of the Attorney General's office. And we knew in March of 2020 and in the following months that survivors would potentially be sheltering in place with the persons that harmed them. We knew that they would be further isolated away from safety nets, support systems outside of their home. And of course, this includes coworkers, even victim service providers, family, friends, faith-based organizations, and so on. And the pandemic, what really happened with COVID-19 was that it exacerbated the conditions that allow for violence to thrive and for victims to become more vulnerable. So those conditions are, of course, isolation and loss of job, food insecurity, housing insecurity. Again, not having access to networks of support that you relied on for childcare and for just general support, right? And so then you add the additional family dynamics that were happening to everyone in the world because of the pandemic, which include potentially losing someone to COVID-19. So grieving and having a loss of a family member. And what if that family member was the breadwinner of the home? And all of these other dynamics as well, right? So I think that it exacerbated the conditions that allow for violence to exist. And of course, it gave opportunities for more harm to be present for survivors, including children. So that's some of the things that I would say.
Yeah. Since your organization serves a lot of advocates and support folks, how has it impacted the advocates?
Exactly what I just said about survivors, that is exactly true for our advocates as
Okay.
well. You know, they were experiencing loss of family members, and specifically for advocates of color, advocates that identify as immigrant. You know, the immigrant community was disproportionately hit by the pandemic, and so you know, time off for them to heal and grieve and have that process for themselves was also a challenge when we have increased demand of services. So I would just say those things.
Sure. Nelly, and we'll go to you next. How have you seen folks, the folks that you advocate for, been affected? How have they been affected through the pandemic here?
Sure. I would agree with Dr. Corona. You know, this really played into, you know, a person who's causing harm, their tool of isolation was strengthened so much. We had survivors who normally would reach out to us at work or would have, you know, respite with family members or, you know, ways to kind of provide some intervention. But all of that was taken away with COVID, and the isolation was really, it made advocates feel powerless sometimes because their normal modes of supporting, you know, that face-to-face interaction, support groups on a weekly basis, meeting, you know, with the survivors that they're concerned about, they weren't able to do that. So it was incredibly challenging.
Yeah. You know, not to not repeat the question the same time again, Kristie, you know, how have you seen, obviously when you're dealing with folks going through difficult situations in their home, there's a lot of fear, there's a lot of difficult emotions. How have you seen a difference in how those emotions play out specifically in the pandemic?
I'm going to step it back and I'll answer that question, but I really, in doing this work over the last many years, one of the things that I always really try and do is help people really understand what domestic violence is like. And so I'm going to step it back there for just a second and then talk about how the pandemic compounds it. So I always start with this place. I want everybody in the room to just think about the one person that knows you better than anybody else. I want you to think about the person who knows you inside and out. They know all of the things that are incredibly important to you. They know the things that are your buttons, we'll put it that way. They know where you live. They have access to your home. They know where your money is. They have access to your money. They know your strengths. They know your weaknesses. They know what scares you. They know where you work. They know all of your, maybe not all of your colleagues, but they know how to get access to all of that. They know who you love more than your own life. And I think that many times we don't think about what it would take to keep us safe from the one person that knows absolutely everything about us. And that's the challenge that victim survivors face, is what does it take to keep yourself safe from the one person that has absolutely all access, knows everything about you, knows every barrier that you face, knows everything that they can manipulate, and knows what they can take advantage of. And that's the thing that as a community, we don't always talk about, that as criminals go, as crime goes, the level of access and leverage that a batterer has is significant. And so then you have to add to that how that kind of trauma impacts an individual, because it's happening in the place that you live. So it's impacting every single aspect of your life, whether it's how you are emotionally responding to a really difficult time with your child, or how you are responding to work pressures and trying to pivot in a pandemic that is crazy for everybody, whether it's trying to be able to get to church without people figuring out that you are, just strung beyond tight. And so the pandemic has layered on. It has layered on the overwhelming feelings of loss of control. And it's layered on all of the trauma of just the unknown of what tomorrow is going to look like. And so batterers have had a really, really super environment for them to work in. Let's just put it that way. You couldn't make it a better environment for them. We saw three homicides in the first couple of months in our service area, when we hadn't had a homicide for 3 years. And we saw our crisis line jump 28% by the end of the first 4 months of the pandemic, and our sheltering costs jumped by 76%. And so the pandemic has had huge costs to it, and has had an overwhelming impact. And for victims reaching out, pivoting our services and pivoting how we did the work that we do, we have actually seen significant increases. We've seen double numbers in some of our communities in terms of the number of people served, but the amount of time it takes to serve somebody when you're doing things almost exclusively virtually doubles and triples our service hours. And so we've got individuals that, trying to help them walk through a no contact order, trying to help them walk through what's happening with a divorce, trying to help them walk through their safety planning, and what's happening with that individual are greatly escalated in the amount of time that it takes and the toll that it takes.
Yeah. And Nelly, along those same lines, what kind of increase have you seen in demand for services?
Sure. Certainly the increase of services. So in terms of like personal advocacy, trying to get, even a hygiene kit or food to a survivor was a challenge. Trying to navigate, housing and emergency shelter, and how we were going to transport, and if we had staff sick. I mean, everything just took a lot longer. So we saw an increase of need in terms of help, filling out paperwork, help, with employment seeking and everything like that. But what we did see is a lot of survivors who, maybe a few months prior were making a safety plan to flee from their abusive situation, and they weren't able to anymore. So they had to stay put. There was a lot of, shelters that were full and doing their best trying to get people, into hotels and things like that. But the survivors who did not want to go to shelter and wanted to stay with family, but that family or that individual, was isolating because they were in contact with someone with COVID, everything kind of stopped. And so, in order for a survivor to leave an abusive relationship, the risk of leaving has to be lower than the risk of staying. And I think the, life-generated risks that COVID presented to survivors, it forced advocates to have to get creative and like, okay, how are we going to lower risk of harm while staying in the home? Because it was safer for them, for some individuals to stay at home. We know lethality risk goes significantly higher when a survivor is changing patterns in the relationship. So it felt safer for a lot of our clients to stay put, to reach out and get emotional support and get, some personal advocacy for other life-generated risks and maintain the family structure as it was. So, in terms of that happened more often during COVID than I've ever seen it in 13 years.
Wow. And then Dr. Corona, from a statewide level, what kind of increase have you seen as well?
Yeah, so, Kristie and Nelly are putting it right on the nail. Nationally, nearly half of female homicide victims are killed with a gun and are killed by an intimate partner. And for Black women ages 18 and 34, they are nearly 3 times more likely to be shot and killed by an intimate partner compared to white women. And so in 2020 in Iowa, 9 of the 10 women killed in domestic violence homicides last year were killed with guns, along with 4 to 5 bystanders. But that's concurrent with what Kristie is saying, right? And that's just to add a little bit more on what Nelly just mentioned, the demand for housing services increased significantly for everyone. Food insecurity, of course, increased significantly for everyone. And underserved immigrant communities were disproportionately impacted on every level. So if they got sick on the job, they had no access to healthcare or no paid sick leave. And immigrant communities even had challenges accessing food benefits. And language access made it even harder for survivors that also identify as immigrant. And right now, for low and moderate income Iowans, nothing is back to normal. They are being evicted. And losing housing impacts the recovery of anyone at every level.
Yeah, for sure. Kristie, going back to you and what you said, that batterers couldn't have a better environment than they have now. In addition to the increase in the occurrence of domestic violence, did we have an increase in the intensity of domestic violence incidents?
Well, I think that research on that is something that's going to come out over time. I believe that anything that I say is going to be completely anecdotal on that level. But I would certainly say that we've seen lethality levels increasing. And we've seen, as Dr. Corona said, the 10 homicides, we actually know that there's been more than that, but that haven't been defined as domestic violence. Mm-hmm. And that's a significant issue that that the community isn't always aware of. Mm-hmm. And so I think that in looking at the severity of the violence that we're seeing, we really, as advocates, you're going to hear us say this a million times, we try not to stratify and say, oh, this one's worse or this one's this. But we know that it's happening, and we're hearing it on our crisis lines, and we're hearing it in our conversations with the individuals that we're serving.
Sure. Nelly, I want to put my next question to you. Even though a lot of us are back to working in person, and we're kind of in this quasi-normalcy stage where we don't know whether we're out of the pandemic or still in it, how have the effects of the pandemic lingered?
No, goodness. I don't think we're out of the woods at all. And I think, there's still fear for advocates, about getting COVID and, fear of, the aftermath of the pandemic. And, even though the eviction moratorium was great and it did provide relief for families, now we're seeing the aftermath where, okay, people are ready to move on and to leave, and they're having to because the evictions are taking place. In specifically Linn County, because of derecho and because of the pandemic, there's not a lot of housing. So I think the aftermath and the things that are lingering are just, insecurity with housing and not having enough of it. And my advocates are scrambling, trying to find affordable housing that it's really so low in Linn County. So I think that's probably one of the residuals of the pandemic and everyone experiencing the potential eviction at once.
Elijah, I'd like to add one thing to that, is that the shelters across the state, homelessness and domestic violence, all of the shelters across the state are still having to work as though the pandemic is in full force. We have not been able to change how our rooms are being used. We've had to add additional apartments to provide security and safety to individuals who are fleeing domestic violence. Mm-hmm. And so even though the pandemic appears to be waning and that we're going to be moving towards a much more normal perspective, shelters can't do that because we still have to deal with the outcomes of infection.
Yeah. And since you both touched on it, I was going to ask about housing. How has the pandemic changed how you had to look at housing for survivors? I guess let's start with Kristie for that one.
Okay, I think that all of the 8 counties we serve are unique and different. So for example, in Johnson County, we've always had issues with affordable housing because of the population density and because of students and who's using the housing and how that housing is being marketed. Having the governor allow landlords to not take housing vouchers and things like that has also had a significant impact in a community like Iowa City and in Johnson County as a whole. And what we're seeing right now is we're seeing landlords that are struggling and they are trying to get back on track. And so they're saying, you know, we're not going to take any type of assisted rental, you know, we're not going to take any kind of rental assistance. We're going to stick to individuals who are waged and able to just out of the gate do what they need to do. In our rural counties, what we've actually seen over the last 6 months is landlords selling off properties because they are not able to sustain during the pandemic, and it was easier for them to do that. So our housing market has diminished significantly in our rural areas. And so that's some of what we're seeing in the 8 counties that I'm serving.
Sure. Nelly, how about you? What are you seeing in the northeastern corner there?
Sure. You know, along with derecho, I mean, there are certainly houses that are not inhabitable, that are inhabitable and not being fixed by landlords. So we're seeing this housing crisis where, you know, some people are just doubling up and trying to make, you know, their living situations work, and advocates are helping them with that. And, you know, something that my advocates do with housing advocacy is, you know, building a relationship with the landlord. And I'll, you know, agree with Kristie, the landlords are hurting as well. Yeah. They're selling off properties. They're, you know, kind of at their wits' end as well. So providing that kind of mediation between the survivor we're trying to help and the landlord has been really helpful. But we're just at a loss because there's not a lot of housing. And then along with funding cuts too, funding is always an issue. A lot of landlords want, you know, not just 1 month of housing assistance. They want, you know, 3 to 6 months, and, you know, victim services are cut all the time, and we're not able to provide that chunk of money for housing all the time. So I think it's really scary, you know, for survivors, and it's really frustrating for advocates who are wanting to place, you know, survivors in safe homes.
Yeah. Since you mentioned that 3 to 6 months, you know, that surprises me. Do you feel that survivors are being put on an uneven playing field, or, you know, essentially have a bias against them when they're not being asked for just the deposit in first month, but 3 to 6 months of rent? A lot of people can't do that.
Mm-hmm. Yeah.
Most people can't.
Most people cannot. And, you know, in terms of like the housing first model, so this idea of, you know, getting a survivor or anyone experiencing homelessness or housing insecurity into their housing first is great in theory. You know, you need to have a safe place to thrive. You need to know where you're going to live in order to get a job and everything. So what we have is landlords not having the income verifications they need in order to place a homeless individual or a victim of domestic violence, and they're wanting more security than from the funding agency trying to get them into housing. And, you know, there's just not enough funding to go around. Yeah. So it is a risk for landlords, but it's more of a risk to, you know, put someone into housing prematurely before, you know, they're, you know, or to expect them to get everything they need accomplished while in shelter or in an unsafe environment before they get into housing.
Sure. Dr. Corona, I want to go to you next. What are the biggest challenges right now in serving survivors effectively? I know Nelly or Kristie just mentioned funding, and I know that's a big issue right now.
Yeah, that is the biggest challenge right now. We just heard from Kristie and Nelly about the increased demand, about the cost of providing services right now, but we're currently dealing with a 30% funding loss for victim services from the Victim of Crime Act, known as VOCA. And so services are more costly because the needs are higher due to the pandemic, especially for housing, as you've heard. It is also harder for programs to use volunteers because of the pandemic. It is harder for programs to fundraise and have large gatherings to fundraise or events in closed settings because of the pandemic. So it takes money and people to serve victims of crime. And we are experiencing that 30% funding loss from VOCA. Without any additional funding, this could permanently change the capacity of our crime victim service delivery network. As of this year, as of October 1st of this year, we're going to be seeing 5,000 less victims served. And then next fiscal year is estimated that there will be 23,000 less victims served because of the VOCA cuts. This is outstanding. This is overwhelming. And we can't say it enough. Victim services need to be funded. If we care about crime victims, we need the money to go to victim services. As you heard, there's a significant unmet need, but that was also true before the pandemic hit. We don't have enough funding for victim services. And now we are experiencing the cuts in the midst of the pandemic and in the lingering effects of the pandemic, trying to still figure out how to navigate the pandemic and how to support survivors across the state of Iowa. Crime victims rely on our local programs for crisis response services, but post-crisis response services, which our programs are currently providing, are essential for long-term stability.
Yeah.
If we don't provide that, it's just going to be more costly overall because people are going to continue to come back for more services, come back again and again. Long-term stability is the goal for every survivor. So lack of funding inevitably forces programs to just prioritize crisis response. It is hard to do. It is more costly. So we need more funds. It's definitely one of the biggest challenges right now.
Yeah. Nelly, tell me about how these funding cuts with the Victims of Crime Act are impacting your organization right now, and what cuts you're anticipating in the future.
Sure, less client assistance, less client served for sure. We mileage reimbursement for advocates to provide mobile advocacy was so helpful. There was a shift in 2013 to provide more mobile response and to go to where survivors are needing us to be, in their own rural communities. And we've had to cut mileage, so we're not going to be able to get there. We're going to have to rely on phones a little bit more. We have no marketing. Our marketing budget is cut. And there's just going to be more next year. We're faced the other portion of that big cut. So yeah, we're seeing it and we're feeling the crunch and we're worried.
Yeah. Kristie, I understand your organization relies a little bit less on VOCA funding. Is that right?
I don't know if I would say less, but one of the things that I took on probably about 12 years ago was that I really wanted to shift the way we're funded, to diversify our funding. I think that nationally, the average is 93% of human services, nonprofit human services, their funding is government or local municipality grant based. And we've worked really, really hard over the last 10, 12 years to shift ours, and we're at a 60-40 split right now. So the first cut that we took, we were able to close down offices that we weren't using during the pandemic and a couple of other resources and maintain all of our services. But that is not, I wouldn't call that the norm. And this next cut is going to be significant. And there isn't any place else for me to cut other than services and accessibility to resources. That's just the bottom line. You only have so many bodies, people committed to this work and that we're able to pay for. And if they're not there, that phone is not going to be, it'll be answered, but when somebody will get to you, will not match the need in any way, shape, or form. It will be significantly difficult. And I think that that's the thing that people don't understand. When we're talking about the long-term impacts of domestic violence, one of the stats I like to share is that on average, a batterer will stalk their intimate partner 21 months after they leave.
Wow.
So, we talk about crisis services, we talk about the emergency services that are so critical, but the bottom line is batterers don't stop. And poverty is this overwhelming barrier. And so if you don't have the support moving forward, you find yourself on this kind of hamster wheel, bluntly, where you feel like you're constantly starting over, or you never gain any ground. And this is not something we want for individuals who are being assaulted. This is not something we want for somebody who is not safe in their own home. That's not a reasonable way for us to look at it in Iowa.
Mm-hmm.
Yeah. Yeah. Elijah, I would just add, that our victim advocates across the state do more than crisis response services. Just consider that beyond, of course, the importance of that response, of the addressing the crisis at the time. Advocates help avoid homelessness. They help people maintain stable employment or attain employment. They help them through childcare or support their children through schooling. It eases the workload of other community service providers in that community. Even assisting law enforcement at crime scenes and helping survivors navigate the legal proceedings enables the legal system to better serve crime victims. This is exactly what our service providers do. Helping crime victims recover from trauma improves the economic stability of the entire community overall. This work is especially value added right now, as service providers across Iowa are overwhelmed in helping communities recover from the pandemic.
Yeah. Do you think legislators, in your experience, realize that added value that folks in your field have, that we're alleviating a lot of the burden on other aspects in helping the community?
I would say that many legislators have really good relationships with our programs across the state of Iowa. Many of those that represent those localities, right? But I don't know if they understand the capacity that we, the extent of services that we provide, and that added value piece that as community validators can talk for us, and say what is it that we really do for them in those relationships, in those professional collaborative relationships across communities. That's exactly what we do. We support community services, state agencies, with food stamps, WIC, and all these other state agencies, DHS, counseling services that are provided by the state. We are part of that network of support for victims. And so I don't know necessarily if they know all those details, but I hope that they get to listen to us today and they can hear exactly. And we are always open to having conversations with them. Have a great policy director who's on the call today, who does extensive work with legislators so that they can understand the impact that our service providers have across Iowa.
Yeah. And on that note, Dr. Corona, what solutions are in the works right now to get past our funding challenges? What has either already been done, or what are you trying to do soon?
Yeah, so ICADVA, along with our sister organizations, the Iowa Coalition for Collective Change and the Iowa Coalition Against Sexual Assault, have requested $20 million in American Rescue Plan Act funds from Governor Reynolds earlier this summer to help bridge that gap of VOCA fund cuts that will impact our programs, as you heard, over years to come. So these funds will also provide support for Iowa Victim Service Delivery Network while VOCA funds recover and while we do pandemic recovery efforts across our communities. So that is one of the requests that is out there for Governor Reynolds. We met with their team earlier in the summer, but we haven't heard from her. And so I just want to put it out there again that we're still waiting, and we are going to be in contact with their offices again to try to have another meeting and to try to push for this funding to come our way. It's not going to cost Iowans anything. This federal funding is coming to states across the nation. It came to Iowa, and it will help us bridge that gap of the VOCA fund cuts that we are experiencing. And as of next fiscal year, it will be an even more catastrophic cut. So as you heard, offices were closed down. Many other offices will be closed down, and the most impacted communities will be rural Iowa communities, communities of color, the elder, children. And so we really need Governor Reynolds to help us with this request. So I'm putting a call out there today for her as well. And hopefully she could get to hear some of the amazing work that Kristie and Nelly and many of our member programs are doing across the state.
Yeah. Kristie, how you touched on this a little bit, but I want to go further into it. How has the pandemic changed the ways in which advocates or in which folks seek your services and how advocates connect with them? Are you relying a little bit more on technology now?
Yes, absolutely. We made a shift almost immediately, and have had a significant period of time that we were almost exclusively virtual. And while that was a resource that staff were used to using, just because it's something we've used in our rural areas for quite a long time. But it was a challenge in that we knew that word of mouth and our visibility in the community was significant in bringing victim survivors forward and places for them to reach out. So for us, it was really about trying to find other ways to connect in addition to technology, and ways to make our information accessible. And so we did quite a few interesting things. One I'd like to highlight, because I think it was such a great partnership across our entire 8-county service area. We worked with food banks, we worked with restaurants, and we worked with Chomp and other local delivery services to have brochures and information and little handouts, postcard-sized handouts in all of the food that was being delivered and that was being picked up throughout the 8 counties. That had a huge impact on people's capacity to reach us and to know that there was somebody out there. One of the things we know about domestic violence, I said this earlier, word of mouth. One of the things we know is that victims don't ever start out calling a crisis line. That's the last place they call. And they always start out with their best friend. They always start out with their mom. They start out with somebody that they trust or respect. And so word of mouth and having our face and name and phone number in such a variety of places is what's critical. We increased our billboards in our rural areas. We were able to get about $6,000 donated to have billboards in Des Moines County and Lee County specifically. And those were a few of the ways that we worked this process. It really challenged us to think about where are the places that people are going to still connect. And so my last example would be Hy-Vee's and Fairways and Walmart food distribution. We've been doing this event every year. It's actually coming up on the 23rd here in Johnson County, called Shop or Shelter, and where we would have volunteers at the door hand out grocery lists for our shelter, and people would pick up an item or two and put it in our basket, and we would take it back to our shelter. And we would get about 9 months worth of food and hygiene and baby supplies in one morning. For us, we knew that that was a place that we could reach victim survivors. And so again, we were having pamphlets, we were having Hy-Vee's do announcements over their intercoms. We were having a whole range of things that were happening with those vendors, with those businesses in all of our communities across the 8-county area that were designed to get that word out to that auntie. Auntie was going to be there and was going to answer that question to that loved one, that niece who is really, really scared and doesn't know what to do. Hey, there's this place you can call. And that was our critical mission.
Sure. And Nelly, same question to you. How have you folks adapted over the last year and a half to make sure you're getting in touch with the people who need your services?
Yeah, very similar to Kristie, but something that it was a challenge when people would call in. having to triage their need to decide whether or not we were going to dispatch an advocate to be face-to-face and take that risk was really demoralizing and hard, So advocates got really good at identifying their immediate needs and making sure, so we would add questions to our, triage kind of screening process to make sure they had access to a phone. And we set aside financial assistance to make sure that all survivors had access to a phone. So we would talk about, okay, where are you going to keep this phone? Where are you, how are you going to, if you're not allowed to have a phone in the home, what is this going to look like to you? So making sure that they had access to reach our advocates was huge. Collaborating with other agencies was also very helpful. So being able to meet people where they're already at. So like a local Hy-Vee or a gas station, that sort of thing. We got really creative around that. And then use of technology, making sure that everyone who did access their advocate via Zoom or, Microsoft Teams or something, knew the risk and understood how to lower the risk while utilizing technology. So advocates got comfortable having those conversations with survivors about the risk of technology and cyber stalking and things like that. So we just relied a lot on phones, computers, and other community members providing the support as well.
There's a lot of little things that we don't have to think about when we're not experiencing domestic violence. It's really interesting.
Right.
Kristie, I know folks in your organization and other similar organizations around the state have always been mobile, but do you feel you were as prepared as you needed to be to rely on technology a little bit more during the pandemic?
No, definitely not. I think that it was a challenge because we went from, and I'll just use shelter for example really quickly. We went from 40 people living in our shelter to having to depopulate the shelter and move them to apartments and hotels for quarantining. And we had to have staff who were used to having an office that they worked out of as a team, a whole team, and everybody shared the same laptop and everybody shared the same phone, to now everybody in our shelter staff having to have a laptop and phone to be able to do their work because they were traveling to our shelter residents in the different locations that they were at. So, the amount of money that we had to put out in the first month, that first March, April range was, those checks were hard to sign. So what I would say is that we did have a significant learning curve because we also had staff who were very used to using the supplies that we had at shelter and were not as tech savvy. And so we had to go through a lot of training, a lot of security, a lot of work with our phone services and all of that to get everybody up to speed and to have the right equipment. So absolutely not, even though it was something that we were used to doing, the physicality of it had to look very different.
Okay. Dr. Corona, since the Iowa Coalition Against Domestic Violence does a lot of policy work around victim services, tell me what agencies are asking for most right now. What are their biggest needs other than, obviously funding? More money would be great. Are there any specifics with equipment or other kinds of needs that you're seeing?
I think housing assistance is a major need. So providing that support either through state funding or even foundations, to understand that that's the need here right now for our victims across the state of Iowa. But, really the funding is what allows us to do any of this work, period. So I would say that the current asks are about mitigating these VOCA cuts, which will have catastrophic impacts to programs across the state of Iowa. And so, of course, the first one, which is the one that I just mentioned, is to Governor Reynolds, for the $20 million of American Rescue Plan Act funds. But then the second is to our state legislators to, it is important for them to increase our level funding next session. We are desperately in need of these funds. It takes federal, it takes state and private funds to do our work. And so if we support crime victims, we need to fund crime victim services. That's the only way that we're gonna meet the needs. If we fail to do this, the most vulnerable communities, as I've already shared, will be significantly impacted. Iowans in rural areas, communities of color, aging populations, children, and programs cannot sustain cuts of this size as of next year. Budget cuts mean fewer staff. It means fewer victims being served, closures of offices in rural areas, and job loss. The data from the Crime Victims Assistance Division suggests that approximately 600 jobs will be lost starting this current fiscal year because of the VOCA cuts. So we need our state-led leaders to increase our funding for services. And so that's what I would say that we're working very hard on right now, along with our sister coalitions.
Yeah. You touched on the barriers that folks from diverse communities have to seeking services, and I wanted to go into a little more depth on that. Our most recent census is showing us that Iowa's population is trending, increasingly more diverse. So tell me about the special challenges that there are to seek services when you're from a diverse background, and how we're working to reach those folks now and in the future.
Yes. So, of course, there are significant challenges for survivors from diverse backgrounds. Addressing the needs of the most marginalized of all will help all people. And currently, what we have in our network of 22 victim service programs includes 7 culturally specific programs. 4 of them, which are in the Eastern Iowa area, that's Amani Community Services, NISA African Family Services, Thrive Together, and Monsoon Asians and Pacific Islanders in Solidarity. They all serve people of color, marginalized community, immigrant communities, the deaf or hard of hearing. And yes, of course, serving these communities looks different. There are added barriers, and the providers need to identify. Of course, these are communities that have been historically excluded, but our victim service providers get training and do co-advocacy work with all of our 7 culturally specific programs. These programs are statewide programs, and I just would like to mention that on top of their everyday dynamics, let's just say like lack of language access that they have to be supported through, there's added barriers of bias, discrimination, racism that victim service providers and victims need to navigate on top of the trauma of domestic violence. And for like over 40 years, these are the exact voices that have been left out of the conversation in terms of how to effectively serve victims of crime. And so as a movement, we do have the responsibility to center those individuals that we've left behind and explore these intersecting systems of oppression, right, that impacts victims of violence across Iowa and beyond. And so to better serve the populations that I'm talking about, we definitely must hire diverse staff. That's the first thing I would say. And also give that staff the tools and space to do what they need to serve diverse communities. And of course, for that, we need more funding, right? But as service providers, we must also focus on the survivor's entire life experience, the context of their everyday life, and the barriers that impact their health and well-being and safety. And of course, this includes, but is not limited to, racial justice, immigration status, the impact of poverty and class, LGBTQ rights, voters' rights, mass incarceration, wage discrimination, job exploitation, and so much more. That is the context of their everyday life, right, for many of them. And so finally, I also want to echo some of what Kristie and Nelly has been saying, which is important for working with diverse communities, which is we must make the time to build trusting relationships with community members from diverse backgrounds. That is essential to reaching and servicing diverse populations.
Yeah. This pandemic has stretched on a little further than I think anyone anticipated. We thought it was going to have its 15 minutes of fame, and it's turned out to be 18 months here. Yes. So, Kristie, how have the last 18 months affected the morale of advocates, and how have the dynamics of burnout played out?
We're tired. We're tired. We've experienced some of the same turnover that businesses across Iowa have been facing. I think that we've been pretty lucky. We've got a really, really strong core team. But the The amount of overtime that we're doing this year, significantly, probably 3 to 4 times higher than we've done in the last 5 years.
Wow.
The amount of flexibility staff have to have in terms of scheduling, it's been incredibly challenging. We're tired, we're overwhelmed, and we're dealing with the same things that everybody else is. And at the same time that we're responding to a crisis that the individuals we're supporting and advocating for are struggling with. And we joke about being ride or die, but we never thought the pandemic would make the ride or die part that much more evident. It's been challenging.
Yeah. And then Nelly, I want to ask the same thing to you, how the dynamics of burnout have played out, especially with a lot of us working remotely, not with our coworkers. Has it been difficult to, get off a hard call with a survivor and not be able to talk to your coworker about it?
Yeah, absolutely. Working in victim services is isolating in itself. This is not the kind of job, you can talk about because of confidentiality purposes, but also there's a lot of vicarious trauma when you relive a story. But having, your office with team members who operate with the same confidentiality, and you can talk briefly about it, is life-saving for advocates, and definitely not having that has made it a huge challenge. Turnover issues, mental health issues. We have, our employee assistance program. I know a lot of our staff has utilized that throughout the pandemic. So we all are experiencing our own hardships, losing family members to COVID, having to keep children home and, out of school, and trying to, teach their kids while, they're still doing this work, and jumping around in your own home that way has really, it's harmed a lot of advocates, but they're strong and resilient, and it's been a challenge.
Yeah. Dr. Corona, we've already talked so much about this, but I wanted to give you a chance to add anything more if you want. What kind of progress would you like to see in the field, and what resources do we need to accomplish that? Does it just all boil down to funding at this point?
At this point, I would say so, yes.
Mm-hmm.
VOCA funds extend the capacity of programs to do their work, and state funding really supports staffing and as well as the expansions of services. And so with these cuts and no additional funding, we are looking again at closures, and just the impact goes down to victims of crime, right? So if we care and we say that we care about crime victims, then we need to fund victim services. That is the point of this conversation for me, really. And also, I think some of the things that I would love to see in the future is, of course, having more focus on prevention efforts. That is imperative to our domestic violence work, or to ending domestic violence. It's prevention. And so without prevention funding, there's very little that we can do in terms of prevention for the future generations, thinking of the youth that are growing up and seeing what is going on, including domestic violence, but dealing with a pandemic and all the violence that has been happening across Iowa and across the nation, really. So I would say those two things.
Yeah. We have a comment in the chat here. Someone said, "Thank you all for the work you do. Your advocates are saints." So you are appreciated by at least one person here. So Kristie, what are your projections for services and the work you do going forward if things stay as they are?
Well, I'll look back a little bit to answer that question.
Mm-hmm.
When I first started this work, we had 38 DV programs in the state of Iowa. We're now down to 22. When I first started in this program, in this work, we had 27 emergency shelters. We're now down to 8 in the entire state of Iowa.
Mm-hmm.
There is no sustainability without fiscal support. That's just the bottom line. And we know how many survivors are out there. We know we're not serving all of them now. and that to cut back even further than what we've already seen in this state and in this nation, it leaves only one answer, and that's death. I mean, not to sound, I don't even know if that sounds alarmist or what it does, but bluntly, that is what ends up happening. We see it over and over again, that when services are cut, when resources are cut, injuries increase and homicide increases. And we know what this is going to cost us, and we're just not saying it out loud.
Wow, that's powerful. All right, we are just about out of time. We have 2 minutes here. So each of you quickly, what can Iowans do to advocate for survivors and help your organizations? And if you'd like to give a little plug to your websites or resources, feel free to do so. Let's start with you, Nelly.
Sure. Yeah, volunteering is always incredibly helpful. So if you visit our website, waypointservices.org, you can get more information about the programs, how to donate. Funding is incredibly important. Addressing the impact of domestic violence takes time and resources, and Iowans are desperate for that right now. So funding and volunteering.
Kristie, same question to you.
I would echo what Nelly just said. Our website is dvipiowa.org. What I would actually say is call your legislators.
Yes.
If you want victims to be safe, if you want them to have a resource, someplace to turn when they're in immediate danger and when they're trying to respond to the trauma that they experienced over, whatever time period it is, the bottom line is we need to tell our legislators. I've been around, and I know that when legislators hear from us, they listen. But they have to hear from us.
Mm-hmm.
Yeah. Dr. Corona, same question. Where can folks learn more about you, and what can they do to help?
Yeah, so I think, first of all, having more of these types of conversations, I want to thank the Gazette and your entire team for putting this panel together, because that's the type of conversation that raises awareness about this issue and that actually gets people to understand what our victim services program advocates do across the state of Iowa. It highlights the work of Kristie, Nelly, and many of our programs. So I want to thank you for that and your entire team. So more of these conversations about intimate partner violence, and also modeling healthy relationships in our homes, in our communities, with our friends, colleagues, and of course with our loved ones. We need to also start believing survivors. We need to change that narrative of victim blaming and change it to supporting. And I invite all of Iowans who are listening today to get involved with their local programs, become a volunteer, like Nelly said, organize a fundraiser, set up a lunch and learn to meet advocates in your community. And of course, to echo Kristie, we need to call our elected officials. We need to ask them to increase our state level funding next session. Call, email, send a letter, call the Governor Reynold, call Governor Reynold. Call her office and ask her to accept our request for ARPA funding to help bridge this gap of VOCA funding cuts. It doesn't cost Iowans anything. It will help us through these next couple of years of alarming, catastrophic cuts. And overall, I would just say that domestic violence is not a single issue problem. Inequality is the root cause of this. If we want to stop and prevent domestic violence, instead of only treating it, then we must challenge ourselves, challenge our victim service programs, challenge our communities and policymakers to prioritize efforts in advancing equality and racial disparities and promote economic justice for all. Yeah. We need to center the work around lifting up those that are carrying the heaviest burdens. All survivors will be served when we do that work. So to learn more about ICADVA, I would say, find us on our Facebook, Instagram, Twitter, LinkedIn, and at icadva.org. Or you can call us as well at 515-244-8028. Thank
Great.
you.
Well, thank you. Thank you, ladies, all for joining us today. We couldn't have facilitated this conversation without you, and it was a powerful one. So with that, we are out of time. So I will let you all go. Have a lovely weekend.
Thank you.
Thank you.
Thank you so much, Elijah.